I want to do a little reaction video to Johnny Depp describing how he lost his fingertip from the medical point of view. So let's follow along in the trial, which is fascinating if you have all day to listen to it. And then let's talk about exactly the mechanism of injury, how this is treated, what you should do in a similar situation. Okay, so let's go. This is a video from the testimony itself in the court. So he's describing the mechanism of the injury, which is very important.
She threw the large bottle, and it made contact and shattered.
So what happened here most likely is that his finger got trapped between the bar and this heavy glass bottle.
I didn't feel the pain.
And that's not unusual.
I felt no
Many
pain
patients
whatsoever.
will describe a sudden shock and they don't even realize something has happened, especially in a blunt injury like this, because it's not the broken glass that has caused the laceration. It's probably what's happened is it's a crush injury where the fingertip is pinched between that bottle that's striking it and the bar or where his finger was.
Had been severed.
So he felt the blood coming out, and that's the warm feeling. But he didn't realize his finger had been cut off.
Bones sticking out.
Now, you know it's below the nail since there's bone there, because the nail is sitting directly on the flattened part of the bone, the distal phalanx it's called.
And
when he's saying meaty part, this part, the pad of the finger, isn't meat. It's actually just
and at that point,
fibro-fatty tissue with a lot of nerve endings.
I think that I went into some sort of, I don't know what a nervous breakdown feels like.
Well, I think he went into a little bit of a panic because he realized that something bad had happened and he didn't realize exactly what bad had happened.
And I knew in my mind and in my heart, this is not life. This is not life.
This is life. You don't want it to be life.
No one should have to go through this. And as I said, this feeling of nervous, being in the middle of some sort of nervous breakdown, I started to write with my blood, in my own blood, on the walls.
So now we're going from the hand injury to more psychiatric, which I'm not really an expert in. I will say that what he's looking at here is the tip of the bone sticking out, the fat that he's severed. So he's looking at the pad of the finger here, that fibro-fatty tissue, the bone, and then some of the nail plate. That's the actual fingernail. It's called a nail plate. And as you can imagine, there's a good blood supply there, so it's probably bleeding pretty brisky by now. Now, what should you do if that happens? You should first you should apply pressure directly to the area that's bleeding, so you can take a clean gauze or even a tissue and clean off the blood, apply the gauze, and then just hold gentle pressure. Even though it's bleeding briskly, it's not going to be able to continue bleeding if you're holding pressure, because the force of the blood is not very high by the time you get to the fingertip. Even arterial bleeding, it's not a very powerful surge of blood. So just gentle pressure should be able to take care of it. And within about 10 to 12 minutes, any bleeding should stop, and you can take your finger off and put a temporary Band-Aid on. Then find the part, because it's going to be very important to bring that piece of tissue in, whether it's just a piece of skin that's mangled or it's regardless of the mechanism, it's better to bring in that tissue and let the doctor in the emergency room decide whether or not they can actually use it and sew it back on.
Severed your finger. What, if anything, did she say when she saw the injury?
I think Johnny Depp here probably doesn't remember the whole thing. He'd been drinking and had been an emotionally fraught kind of situation. But
attack of insults, it was just jumbled words to me in a very high frequency, and I
so I think that's enough of the video because it describes the medical portion here. Let's just review. So the fingertip is a complex area. We have the nail plate, the hard nail. It's sitting on what's called the sterile matrix, which is a little pad like the padding of a that you put down before you put carpet down. That's sitting directly on a flattened bone that's the distal phalanx, and that flat bone is what the nail sits directly upon. Underneath the bone is this, what he's describing as the meat. That's fibrofatty tissue, and if you open that up, what you see is little globs of fat that's sort of tight with fibrous tissue, as well as little organelles that sense temperature and pressure and all the sensations of touch that we have. And you can see a lot of those with the naked eye, that basically they're transducing temperature, pressure, light touch, vibration, heavy touch. They're transducing those physical characteristics into nerve impulses that go through the digital nerve, the sensory, this is a sensory nerve, all the way back up to our spine, from the spine into the brain, where we sense that what is going on. And in a way, you can look at the fingertips being our sense of touch with the rest of the world, and the arm, the shoulder, everything else just there in order to get those fingertips to whatever it is we want to touch and manipulate. So I hope that helps. Here's the lesson. If this happens to you or somebody that you encounter this, first stop the bleeding, gentle pressure with a clean gauze or even napkin or something cotton, because the cotton will stop bleeding. Just gentle pressure. If it's still bleeding underneath that, take it off, clean the surface. Even though it hurts, you can do it quickly. Apply a fresh gauze and apply fresh pressure directly on the area that's bleeding. That should be able to control it. Once you get the bleeding controlled, the person's sitting down, find the part. Don't go to the emergency room without the part. Bring the part in. If you need to store it for a while, you can put it in a cloth or even a napkin, whatever clean thing that you can find. Put it in a little container if you can find one. Don't worry about putting it in water, that sort of thing. I wouldn't do that unless you happen to have sterile saline. But if there is a little blood, the blood is relatively balanced and you can put it in a bloody gauze that will keep it a little bit moist. Then you should be able to get to a hospital, to a doctor, urgent care within an hour, 2 hours, 3 hours. And even the next day, that amputated part can be useful to the doctor taking care of the injury. So I hope that helps, and I hope that never happens to you or anyone that you care about. And I hope that you learned a little something from Johnny Depp's unfortunate accident.